The flowers are starting to bloom. The weather's beginning to warm up, isn't it? It's absolutely
all the
beautiful.
good stuff.
And sadly, for hay fever sufferers, runny noses and watery eyes are back.
Yeah, if you're one of the millions of people in the UK who struggle with seasonal allergies, Professor Adam Fox is joining us now with top tips for the month ahead. First of all, what is hay fever?
It's an allergy. It's an allergy to pollen. And every year, the trees release all their pollen, and then grass releases all their pollen. And if you're unlucky enough to be allergic to it, the pollen granules get up your nose. They cause an allergic reaction that causes the release of a chemical called histamine, and that causes all sorts of horrible symptoms. So an itchy nose, a runny nose, a blocked up nose. And for some people, it can be really significant. Their eyes are affected, and there's been loads of studies showing just how much of an impact, if you've got bad hay fever, it can have on your exam performance, because of course we're coming into exam season. And if you're an adult with bad hay fever and you're not treating it properly, then your reflexes will be about the same when you're driving as if you're over the drink drive limit.
Do you know what? That is so true, because I do suffer with it, and it's debilitating, honestly. It's like the worst thing ever. But when is it and it's worse?
So it depends what you're allergic to. So if you're allergic to tree pollen, we're coming into the season now. So the pollen levels are starting to rise, and they'll peak in around April time, and then they'll ease off. And so if you're only allergic to tree pollen, you'll start getting relief as everyone else is getting sniffy.
Yeah, that's what happens to me.
Yeah, because more common is grass pollen allergy. Yeah. And that starts to rise in April, but it peaks in May and June. Sometimes there's a little bit of a second peak in July. But it really depends on things like the weather and the pollen count and all sorts of other things as well.
Well, so I was going to ask you, how does the weather affect it?
So the worst possible is a nice day with a gentle breeze, because that means that the pollen will be getting released and it's getting blown around a lot. Whereas if it's raining, then the rain will just sort of capture the pollen granules and bring them down to earth, so they're much less of a trouble. But then, of course, there's other factors. So whereabouts you are. If you're by the coast, it will be better. If you're in an urban area, it will tend to be better than the countryside, for example.
So what about people who don't usually suffer from hay fever? Can they be affected as well?
Well, there's a lot of people who will suffer even at low levels, and then there's probably even more that will only suffer when the levels get really high. So there'll be certain days during the year where the pollen counts will be super high, what we often refer to as hell days for those who have got bad hay fever, where it's just shocking. But you'll get a number of other people who didn't think they had hay fever would start to get a little bit sniffy on those days. It's just that their hay fever is very mild, and it's only when the levels are very high that it starts to break through a little bit.
Are more people getting it? Like, it feels like that more people over the years, I don't know why that is, or whether it's just you're more aware of it.
Yeah, I mean, if we compare now to 40 years ago, yes, there's more. If you go back 200 years, it was unheard of, so it's quite a new disease.
But why? Why is that?
Well, I think some of it is because, well, there's a lot of theories about why there's more allergy around generally. Some of it is to do with our gut microbacteria, what we call our microbiome, and that's changed over the last 40 or 50 years. It's made us not quite as good at managing how we interact with our environment, and we get these funny immune reactions. So we're seeing more food allergy, we're seeing more asthma and eczema, and also hay fever.
It's all on the rise.
Yeah, but whether it's all on the rise so much now, probably not so much. I don't think we're in the middle of sort of a rising epidemic. There's already a lot of it around. I think, though, if you look over the next 10 or 20 years, the bigger problem is going to be that the pollen levels are probably going to get higher. The pollen season's going to get a little bit longer.
Because of climate change.
Because of climate change, yeah.
God, could you ever, like, confuse it, like, with, like, COVID or a cold?
Yeah, I think over a short period of time, you know, if you're bunged up and sniffy, then there's a number of different reasons. But if it's happening every year, if it affects your eyes, that's more likely to be hay fever than infection. If you've got a temperature, it's not hay fever. So despite the name, there's no fever caused by allergies. And then, of course, if you get better with antihistamines or other allergy medicines, that's a big clue that it wasn't a cold. Yeah.
So I guess getting ahead and preparing for these months is the best way?
Yeah, because there's some medicines that if you know you've got a problem, starting on them before the season really kicks off will make a big difference with how well you respond to the medication.
So could you start, like, now with something?
I'm already suggesting to many of my patients that they get going with their medication. And if you've got proper hay fever that's really troublesome from one year to the next, one of the most helpful medicines are nasal sprays that have got a little bit of steroid in. They're very safe. For adults, you can get them over the counter. For kids, you need them prescribed. But starting now before the season starts will put you in the best possible place. And then when the symptoms start kicking in, you can then add in the antihistamines. A lot of people start antihistamines before the season. There's not really any value in doing that.
Doesn't work.
It doesn't help.
Is good.
You just need to wait until the season starts.
I know this sounds daft, but is there a right and a wrong way to put the nasal spray in?
Yes, there is, absolutely. And I'd always suggest either asking the pharmacist or looking in the package insert, or just go on YouTube and look up how to do it. But you have to point it the right way, and lots of people don't. So always use the opposite hand to the nostril that you're squirting it in, and you want to sort of go up and back.
Up and back.
Yeah.
Up and back.
Yeah.
All right, well, let's go through all this. So we've got the nasal sprays, antihistamine tablets.
So antihistamine is really, really important first line. So for lots of people with mild hay fever, they're really good because you can take them when you need them. You don't have to take them when you don't need them. They're available over the counter. Biggest pitfall is being given the wrong ones. So often you might get recommended an old-fashioned first-generation antihistamine.
Yeah.
They're sedating, they're short-acting, they're just not very good for hay fever. So you're actually going to be much better off making sure that you ask for a more up-to-date one. So something like loratadine, cetirizine, fexofenadine. There's lots of different brands, but as long as it's one of those non-sleepy, long-acting ones, that will work best.
Eye drops.
Yeah, so really good, but don't forget that the reason that your eyes get sore in the hay fever season is less about pollen getting in your eyes and more about a reflex from what's going on up your nose. So over-the-counter eye drops, not great really, but actually think about a nasal spray because that will often really help your eyes.
Oh, OK.
Right.
There are some things you could do at home without the medication that can help. I mean, it probably won't stop it entirely, but it will help things. Things like don't hang your washing outside. Other things, wear glasses instead of contact lenses to avoid irritation. Is that just because you don't want to be putting anything in your...
Yeah, exactly, and bothering your eyes is just going to make it worse.
What does the Vaseline do?
So that will work as a pollen trap. So if you put something sticky, like just petroleum jelly around your nostrils, some of the pollen that's trying to get in will get caught in there. So rather than getting up your nose, it'll stay outside.
That's a good idea,
That's a good idea.
Yeah.
If you've got asthma and hay fever at the same time...
It's really common to have both of those. So lots of hay fever sufferers will also have asthma. Many people with asthma will also have hay fever. And it's one of the most common triggers for your asthma to get problematic.
Yeah.
And in fact, if you can watch as the pollen count goes up, admissions to A&E with asthma attacks go up as well. Yeah, and it's because the inflammation at the top end of your airway from the hay fever starts sending angry signals down to your lower airway where the asthma is and will kick that off. So if you've got asthma, make sure you're taking your asthma medication regularly as prescribed and make sure that you're dealing with your hay fever. Don't just let it ride.
Okay. What if your hay fever affects your sleep?
So that's when it becomes really troublesome. And in fact, one of the ways it's particularly problematic for kids, for example, doing their exams is, and we know, for example, that if you've got hay fever, you're more likely to drop a grade from your mocks that you do at Christmas time to your summer exams. And so it's, it's a serious issue. And if it's affecting your sleep, that's going to impact on your concentration, your ability to perform, etc. So I think if that's happening, just make sure you are taking it seriously, you're taking the proper medication. And if you manage it, nasal sprays, antihistamines, you should be okay. But always worth thinking about things like washing your hair before you go to bed, because if you've been out all day, got a load of pollen in your hair, you're then wiping it on your pillow and then wiping your nose in it all night. So you're going to wake up stuffy again. Makes sense,
doesn't it? And obviously you can manage this with over-the-counter products like we've discussed here, but when do you see your GP?
So there's maybe 15–20% of people who, even if they take the nasal sprays, they take the antihistamine, they do everything right, they've still got a problem and it really is impacting their quality of life. Those are the people I'd encourage to chat to your GP, because often increased doses of making sure you're on the right medicines will all help. But there's also next line of treatment, so desensitization, what also used to be called immunotherapy. So a treatment that can actually make you less allergic to the pollen so that over the course of a few years it gradually gets better and stays better. Definitely worth thinking about.
Is that an injection?
So it can be done with injections. More typically, we do it with tablets that go under the tongue. There's also an injection, something called Kenalog, which is an enormous...
That's what I want.
No, you don't. Oh. No.
No, you don't.
Okay.
You don't. Just Google it and see what comes up.
Oh, OK.
It will be all the class actions against the people that make it and things like that. It's sort of been banned on the NHS now. It's an enormous dose of steroid and it can have long-term side effects.
Oh, OK.
So, yes, it's really effective short-term.
But not so much.
No.
Thank you very much. It's good to talk to you, especially in
Adam.
advance of this becoming a real problem for lots of people, because it does make life really miserable. Thank you.
Thank you,
very
Adam.
much.